Obesity in older age is not just a matter of extra weight, it's a profound disruption of the aging process itself. While many individuals with obesity do live into old age, what often goes unnoticed is the heavy toll it takes on how they age. It's a mistake to view longevity purely in terms of years lived. The deeper, more pressing question is, what is the quality of those years? In the context of obesity, the answer is often sobering. A longer life is not necessarily a better one, especially when burdened by chronic illness, physical limitations, and cognitive decline that could have been mitigated or delayed with better metabolic health. The link between obesity and shortened lifespan is well established, particularly in cases of severe or long-term obesity. Excess weight increases the risk of heart disease, type 2 diabetes, stroke, kidney failure, and certain cancers, all of which are leading causes of death in older adults. While medical advances have extended life expectancy for many people, including those with obesity, this extension often comes with a catch. The extra years are more likely to be spent managing illness rather than enjoying health. It's a life prolonged by medicine, not preserved by wellness. But even when obesity doesn't significantly reduce lifespan, it nearly always undermines the quality of life in older age. Everyday activities, walking, dressing, climbing stairs, playing with grandchildren become more difficult. Joints ache under the strain of excess weight. Sleep is disrupted by conditions like sleep apnea. Fatigue becomes chronic. Inflammation clouds the mind, blunts motivation, and accelerates the decline of multiple organ systems. For many seniors with obesity, the final decades of life are marked not by joyful retirement, but by medical appointments, prescription regimens, and progressive loss of independence. There's also the issue of frailty, a paradox in older adults with obesity. While excess fat may seem to offer some physical reserve, the loss of muscle and strength that often accompanies obesity in aging creates a fragile state known as sarcopenic obesity. These individuals may look heavy but are physically weak and vulnerable. They're more likely to fall, more likely to suffer complications from surgery or illness, and more likely to become dependent on others for basic care. In many cases, weight that once seemed manageable becomes a barrier to dignity when getting out of bed or using the bathroom requires assistance. Cognitively, the risks are just as severe. Obesity is a known contributor to cognitive decline, increasing the risk of dementia, particularly Alzheimer's disease. The mechanisms are complex. Chronic inflammation, insulin resistance, oxidative stress, and vascular damage all play a role in impairing brain function. In the context of aging, where cognitive reserves are already shrinking, these metabolic insults accelerate mental aging. The result may not always be a clinical diagnosis of dementia, but it is often a slow erosion of memory, attention, decision-making, and emotional regulation. Obese older adults may live longer, but often with foggier minds and greater emotional distress. And yet, despite these risks, there is also a persistent myth that obesity in old age may be protective, a phenomenon known as the obesity paradox. Some studies have suggested that mild to moderate obesity is associated with lower mortality in older adults. But this observation is highly misleading and often based on flawed assumptions. Many of the so-called normal weight individuals in these studies were underweight due to illness, making obesity appear less dangerous by comparison. Furthermore, while some body fat may help weather acute illness, the chronic burden of obesity remains deeply harmful over time. It is essential, then, to distinguish between survival and thriving. The goal of aging should not simply be to stay alive as long as possible. It should be to remain active, independent, mentally sharp, and socially connected. Obesity makes that goal much harder to reach. It shrinks the window of vitality, pushing people into years of compromised function long before the end of life. It may allow people to reach 75 or 80, but at what cost? At what level of pain, isolation, or dependence? The warning here is clear. Obesity in older adults must not be ignored or downplayed simply because someone has made it into their senior years. The real measure of healthy aging is not just how long we live, but how well. The presence of obesity undermines that quality on every level, physically, emotionally, and cognitively. That said, it is never too late to make improvements. Weight loss, even modest, can have powerful effects in older adults. It can reduce blood pressure, improve glucose control, ease joint pain, and enhance mobility. More importantly, when done carefully with attention to preserving muscle mass and nutritional status, it can restore a sense of control and self-efficacy. Seniors who eat better, move more, and reduce inflammation are not just adding years to life. They're adding life to years. The approach must be compassionate and realistic. Dramatic weight loss is not the goal. Nor should we shame or stigmatize older adults with obesity. But we must stop pretending that obesity in late life is harmless or inconsequential. In reality, it's one of the most important factors determining whether the final years of life will be a period of independence and engagement, or one of struggle and decline. In a society that increasingly celebrates longevity, we must ask a harder question. Are we extending life, or just prolonging death? If we want the answer to be hopeful, we must confront the role of obesity in shaping how we age, and act before more lives are filled with years, but emptied of vitality.